All right, everyone. Welcome back to the masterclass on Altered States Unplugged. I'm your host, Kyle Strubing. I am here with Dr. Justin Feinstein. Doc, how we doing today?
Doing good. Thanks for having me.
Absolutely, absolutely. I'm going to give you a little intro here. Doc is a PhD. He's a clinical neuropsychologist, so he is very official. He is the president and director of the Float Research Collective. And he is an expert in the neuroscience of fear. I saw that on the website. I thought that was fantastic. Tell me a little bit about that.
That's actually how I got my start into floating. Is I was a postdoc in Caltech, which is the same university that John Lilly trained at many decades ago. And I was really trying to understand what are the brain circuits involved in our experience of fear and anxiety. And as we were studying these brain circuits, this concept of interoception kept coming up again and again, which is how does the inner body connect with the brain? How does the heart connect with the brain? How does the breath connect with the brain? And we were trying to understand the circuitry that was involved in this brain-body connection. And that's kind of when I stumbled upon floating. And this research assistant in the laboratory came to me one day and said, "Justin, you have to go do this." And at the time, everyone was referring to it as a form of sensory deprivation, and it kind of scared me. In fact, it took me about 3 months to build up the courage just to go have my first float because of this. But ultimately, what got me to do it is the research assistant kept saying to me, "Listen, don't listen to the word sensory deprivation. This is not what is happening. When you go in there, you'll understand that what's happening is exactly related to the area of neuroscience that you are studying, interoception." And so I go in for my first float a couple months later, and I remember maybe 10, 15 minutes into the float, audibly laughing out loud, like you could hear it echoing in the chamber. And it's because the experience was the exact opposite of what I had feared those few months that I had sort of waited in anticipation of actually doing it. And part of what was the exact opposite is it was not anxiety inducing. It was actually reducing anxiety in a very profound way. So I thought that was very interesting. And I studied anxiety, so I knew this had some very big potential to help people. But then beyond that, it was this significant enhancement of the internal world of my body. Suddenly, I could feel my heart beating. I could hear my heart beating.
Blood racing through your veins.
Yeah, I could feel my breath. Every breath was this sort of giant sensory experience. And in some ways, the environment almost became this automatic meditative environment. I didn't have to do any work. It just sort of shone the spotlight of attention on present moment sensations like the breath. It was incredible. And it made me realize that what people had been referring to as sensory deprivation all those years was actually a form of internal sensory enhancement. And this is something that I think we need to understand as a float industry, that what we're doing here is we're not depriving the senses at all. If anything, we're enhancing these internal senses that are so fundamental when it comes to things like the experience of anxiety. These brain-body connections are oftentimes what get most disturbed in somebody who has chronic anxiety or fear. And so being able to regulate those connections is actually paramount to helping give relief to these patients.
Yeah, one thing we've noticed and one thing we preach in the stores is, kind of seeing that anxiety, right? And we preach a lot of visualization and manifestation throughout that to try to, we always say there's a million possibilities that could go on in a certain situation, and you're only focused on the two negative ones. So it's been super powerful for us to have people come out. And then I use it a lot in my own life to where if I have a tough meeting, I'll go in and you know, I have already floated about it. So I feel like, yeah, I've already been there and I can see these things, and it's been super powerful. I'm wondering just, and they use that a lot in sports. I got that from the Ohio State. They had a sports psychologist there who they use float therapy fairly regularly, and he was talking about visualizing the ball coming in and all that stuff, and it's something about the connection and disconnection with your body between your brain. In the float tank, is there something to that? Is that kind of, is that what's happening in there? Or how does that kinda manifest, I guess, internally?
I think this is one of the most fascinating parts of floating. You look at athletes like Steph Curry, right?
Yes.
He has that great commercial from Kaiser Permanente where he's talking about floating not as a tool for recovery, which is oftentimes what athletes think of it as,
Sure.
but actually as a tool to help his mindset in the heat of the moment. And, one of the things I really love about Steph is he's one of the most clutch, sport, players of all time in all sports. And whenever there's that last minute situation, last second situation, they get him the ball and he'll make that shot and he looks so relaxed. He looks so calm, so unperturbed. In those situations, 99.999% of the population would freak out, right?
Couldn't even put their shoes on, yeah.
But somehow he manages to stay calm in the midst of that storm of adrenaline, of your heart palpitating, of all of that tension and pressure, right? He stays calm. And I'm actually convinced that one of the main ways he's able to do that is because of floating.
I think he's done it 1,000 times already in his head, and so
That's part of the visualization that you're talking about, but
yeah.
another part of it is that mind-body connection that I'm talking about, this interoceptive piece, where suddenly you could feel your heartbeat, suddenly you could feel your breath, and where are you feeling it? You're feeling it in the context of total relaxation, right? Your blood pressure is down 10 or 15 points. All of your muscle tension throughout your body is reduced to an absolute minimum. And then suddenly now you're feeling these internal visceral sensations that outside of a float tank are normally linked to the experience of stress and anxiety, right? When Steph Curry's in that last second situation, most people are feeling their heart palpitating like crazy, pounding out of their chest is the way a lot of people describe it, right?
Yeah.
And now Steph could go back to that experience in the float tank when he was feeling his heart beating and reinvigorate all of those feelings of relaxation. That's what floating gives you is this superpower to stay calm in the face of the storm, which is the stress of day-to-day life. And to me, this is the part that I think is mostly missed by the people who hear about float therapies. I think they view it as a tool just for recovery purposes. It's not. It's actually a tool to get you more in tune with this mind-body connection that really influences every aspect of our life.
Yeah, that's a big thing, or the misconception that they're gonna have some psychedelic experience or something that was, that they read about or saw. I think Stranger Things had an episode on it, and Lisa Simpson floated and things like that. It's like, just these misconceptions of you're gonna have, you get some first timer in there and they're like, "Oh, I wanna go. I heard it on Joe Rogan," and it's like taking mushrooms, and it's like, "Brother, do you meditate at all yet?" Like, where you would have to you kind of walk before we sprint. But yeah, no, it's pretty interesting for sure.
We actually, measured a lot of these things in our initial studies with people who had severe anxiety, severe PTSD. We were worried about, potential issues, and we looked at everything from hallucinations to panic attacks to flashbacks and so forth. And what was amazing to me is these are, patient populations. So these are people who have a lot of, clinically significant issues that are affecting their lives. But we did not see these safety issues. We did not see these types of side effects. And in fact, when people did see what you might call, visual elements, right? You're in a dark environment, but when people did on occasion report seeing things, it wasn't a hallucination. We never heard reports of somebody seeing something that wasn't there. What we heard more often was the report of sort of auras of color
Yes.
that would suddenly fill the visual field. So, like, suddenly, instead of being black, you might see, like, shades of purple or orange or red. We heard, occasional reports of that, not very often, but occasional. And, in general, it was nondescript. So these are not like hallucinations the way that people are talking about them at all. And, people can have altered states in there. We have measured altered states of consciousness. But what we found is it's a very pleasant altered state. It's something that is called this sort of oceanic boundlessness, where you sort of, you know, really immerse yourself in the present moment. You feel very expansive and infinite in your thoughts, in your body space. You feel very free and liberated. Some people refer to it as an almost out of body like experience on occasion. And you could think about this, you're in a zero gravity situation, right? So it is kind of like floating in outer space. And even Richard Feynman talks about this in his autobiography, but there is this indelible aspect of floating that's, difficult to describe, but it almost frees you from your outer body. And, I think this is a very powerful piece of why floating is so important and why we have to calibrate the temperature of the air and the water to be so precisely matched to your skin temperature. What we're trying to do is create this effect of body dissolution where suddenly there's no boundary between air, body, and water. And now you could kind of immerse with your external environment. This is a very powerful part of floating, and it's very difficult to achieve that in any other modality.
And as a provider, it's something you're constantly monitoring too, right? It's like you can't leave the door open too long. You wanna always manipulate that in something that we're very because that's all you can think about then, right? If the water is smell if there's a smell or something or light penetration or something like that, that's because there's nothing else to focus on. That's all they focus on. So it's very important as providers for that for sure. I guess just it's some initial somebody comes in, and obviously we're not medical practitioners, but we're guides within the store. Somebody comes in saying that they heard about float therapy and helping out with their anxiety. What would be a good protocol, some tips or some recommendations for us to provide to the customers that are coming in?
I think the most important thing you have to recognize with anxiety is there is going to be a lot of anxiety going into the experience. This is the nature of having clinical anxiety. You get anxious about anything that's novel, new, uncertain.
Sure.
And so the best thing you could do as a guide is really try to make sure they realize and recognize that they have complete control over the experience, okay? They could get in and out of the pool whenever they want. If they wanna go in and float for a minute or 2 and then hop out and take a shower and then hop back in and then hop back out again, they could do it as many times as they want. This is their environment, this is their freedom. If they wanna keep the door open to the float pool, tell them just keep it open. If they wanna keep the lights on during the float, tell them just keep the lights on. If they wanna have music playing during the float, tell them have music playing throughout your float. I think the most important thing you could do is encourage somebody who's anxious to take this experience at their own pace. Don't feel like they have to go into the fully immersive float experience right away. They could take several floats or even more to build up towards that. Or maybe they never have to build up towards that. But the idea is just get them to participate in the experience, get them to try it. If they float in the pool with the doors open, the lights on, and the sound playing, they're getting a taste of the float experience. And it's gonna become that much easier the next time they do it. So I think that's one thing I always, would encourage, float center operators to do is just make sure they recognize they have complete control over the experience. The other thing I would do is encourage them to spend the first part of the float really, stretching their body out. A lot of people with anxiety have muscle tension throughout their body. In fact, they hold their stress and anxiety oftentimes in the muscles of their body. This is a common part of the experience of anxiety that often gets missed. And I think just adjusting to the water, adjusting to this almost zero gravity like environment takes some acclimating.
It does. Yeah.
And so I always encourage people, in the first part of the float, especially, just spend some time stretching all of your body out in all directions. Really be comfortable in the environment. Let your neck go back and forth. Really feel comfortable with the water holding up every muscle of your head and your neck and your spinal cord. I think letting them just acclimate to the environment, get used to the environment, is gonna help their nervous system settle in a little bit easier. And then the final thing I would say is just recognize that it takes time to acclimate. It's not gonna always happen in that first float. And I always tell people, make sure, that people recognize this is a practice and that you wanna give yourself at least 3 to 4 float sessions just to let your nervous system acclimate to the environment. I think that's very important.
Yeah, we always kinda have this mantra that first float is the worst float. Not that it's bad, but it just continually gets better and better and better, and you touched on it for 100%. You're coming into a new place, you're doing something that you can't really relate to. You've never met me, you've never met the staff, you don't know where the bathroom is, this is going to be a little different, and then at the second time you come in, you know what to expect, and you can kinda get right into it. That's great, that's great. Any time that they should do? Like, when we do, like, hour-long sessions, for me, I've worked my way up past that. Is there a good intro? I mean, are you anti 30-minute floats out, like, or just as long as you can do?
No one had actually studied this question until we decided, you know what, we need to put this to a proper test. So we published a paper last year, and this was the first time NIH had ever funded a float study. But one of the questions that we asked in this study is, what is the preferred duration of floating for people who suffer from anxiety or PTSD? So once again, this is a patient population. Now, when you ask somebody with severe anxiety or PTSD, and you say, listen, I'm going to have you go in this room by yourself along with your own thoughts, how long do you think you'd like to be in there? Most of the patients I worked with would say, oh, maybe 10 or 15 minutes. That's the most. That's it. And then I'll be done. That's more than enough. But in this study that we just published, when we let them select their preferred duration, they could float for 5 minutes or they could float for several hours. It's up to them. It turned out the preferred duration of this group was actually 75 minutes.
Perfect. I'm telling you, 75 minutes is the sweet spot.
It's really fascinating, and in our first study, we didn't allow them to do that. We actually had a 60-minute float session, and a lot of the patients came out of that saying, "I wanted to float longer."
Yeah.
So actually, 75 minutes is 25% longer. So I think, that seems to be the sweet spot that we're seeing in our research studies that seems to create the most prolonged benefit as well. And in the Maui Calm Project that we're getting ready to launch here, for all the fire survivors on Maui, that's the amount we're going to use. That's the duration, 75 minutes.
Awesome. Awesome. Well, this is a good segue. The Maui Calm Project, and how else, what other projects do you have? How else can people find you? How could people learn more about the Float Research Collective and all that stuff?
Yeah, absolutely. So, a couple things. We have a nonprofit. It's a 501(c)(3) called the Float Research Collective.
Yes.
The website for that is clinicalfloat.org.
Right.
And you could learn all about the research studies that we've been talking about. In fact, we have a whole repository of all those studies on our website. You could learn more about our nonprofit as well. And then we recently, when the fires hit Maui, launched the Maui Calm Project. I live on Maui, and so I was here when the fires hit. This was a real devastating period of
Just
time.
terrible.
And it continues to be so because we are so rural here. We just don't have the infrastructure to address a crisis like this. We really don't, and we're still reeling. and there's just no mental health care at all, to really handle a crisis of this magnitude. So I was able to go out and get some grant money in order to bring float therapy to Maui and provide it free of charge to the whole population that's been impacted. So all the fire survivors, all the first responders and firefighters that are floating. And then we're really excited to launch this later this year in Lahaina, and it's gonna be an unprecedented sort of study of how to use floating to help people in the acute stages of stress and trauma and helping them recover. And I think this could be a whole new model for how we view float therapy in the aftermath of a disaster or traumatic event. So that's one of the big initiatives that we're doing as a nonprofit. But then the other big initiative is something that all of your float centers could actually help with actively,
Yes.
which is, I've been studying floating now for, going on almost 15 years. And, all of my research was done in my laboratory, which only had two float pools, right? And when you look at all the prior float research in other laboratories, it was also similar setup. So we never were able to do a large scale research study. When I would study patients with anxiety, we'd study, anywhere from 50 to maybe 100 patients, which is a pretty decent sample, but it's not big enough if you want the medical powers to be took this seriously, right? And so when I started this nonprofit a couple years ago, one of the major goals was to create a collective of float centers around the world. And we're trying to hit 100 float centers. We're pretty close. We have about 60 currently signed up for this. And these are float centers all over the world. We have USA, Canada, United Kingdom, Australia, New Zealand. And the idea is we're going to launch later this year the largest float study that has ever been conducted. It's called Project Arcturus, and we're going to study over 1,000 people who float on a regular basis. And we're really going to understand the why. Why are they floating on a regular basis? What are the health reasons, the clinical reasons? What are the non-clinical reasons that are driving them to do this? And really, how long are these effects lasting for? What does it seem to benefit the most? We're going to ask this in a very broad, expansive way because right now our nonprofit is focused on things like stress and anxiety, but we think there's a whole range of reasons that your own could potentially be benefiting, and we just need to understand the full scope. So this is gonna be a groundbreaking study. I see that there's already, one of your, locations signed up, right, Kyle?
Yeah, the one is I'll get the other ones in, and we're all on board with it. I've developed a ton of I've gotten, to know a lot of these people personally. They'll 100% participate. We have commits from it too. So
That's fantastic. Yeah, we're trying to get signups now, and we're hoping to launch later this year. And if there's float centers, who might be struggling right now, because we know this is a very difficult economy. We have also launched a sponsorship program where float centers who have been donating to the nonprofit for the past few years could help sponsor you to participate in the study.
cool.
So we want to make sure you get involved in any way, shape, or form because we think this is such an important study to actually be done for the industry.
Absolutely. Yeah. And however we can contribute to that, if you need me to hit the phones and get people to sign up too, I'm good at that. We can make that happen, get people to commit. But no, so Project Arcturus, that's coming up later this year. Check him out on, clinicalfloat.org. He's got a bunch of other podcasts he's been on. So Doc, fantastic. Really appreciate it. Any parting words for us before I let you go?
I would say just understand that this is a very novel technology. Even though it has been around for about a half a century, it's been mostly unknown. And
Right.
to this day, I would say only about maybe less than 1% of the population has ever actually heard of this, let alone tried it.
Right. Yeah.
I think we're just beginning to scratch the surface of public consciousness. We're really in the earliest stages of this. And to recognize that this is a marathon, it's not a sprint.
Right.
People are going to learn about this as more and more research and data comes out about all of the amazing benefits that float therapy can provide. I think it's going to be this amazing boom for people who are really struggling with some of the most chronic and disabling ailments of our time. And I think what you're gonna recognize is that you provide a very powerful form of healing for your community.
Right.
And when the community starts recognizing that, when the medical system starts recognizing that, I think you're gonna quickly see these types of centers popping up in every street corner. It's gonna just become a way of life in our society. I think it's gonna be an antidote for a lot of the struggles that we're gonna see emerging in the next decade or two, just with technology
Yeah,
and overstimulation of technology.
for sure.
So, just recognize it's a difficult economy right now. We're going through a very difficult time economically, but at the same time, the technology that you're providing for your community here is actually the antidote that's going to help them overcome this difficult time. And realize it's a marathon, it's not a sprint.
That's I couldn't have said it better, my man. I really appreciate you hopping on. Yeah, go check him out. Appreciate you coming on, Doc. Thank you.